Namaste students, my name is JVS Dr. Neeraj Bholia, Faculty of Agriculture and Veterinary Science, Jayoti Vidyapeeth, Women's University, Jaipur. Today we are going to discuss about the tuberculosis, and this belongs to the subject medical biotechnology. So the tuberculosis is a infectious disease, and the cause of the disease is the infection of the bacteria, that is Mycobacterium tuberculosis. The bacteria generally it affects the lungs, but it can also affect the other parts of the body. Most of the cases are asymptomatic, means the bacteria is there, but there is no symptoms of the disease. So in these cases, that is known as the latent tuberculosis. So about 10% of the latent infections progress to the active disease, which if left untreated, it may have the harmful impacts. Okay, so the sign and symptoms of the tuberculosis depends on the site where the bacteria is growing or it is affecting. So because generally it affects the lungs, so if it is affecting the lung, there may be a cough which is long lasting. Is if the cough is from 3 weeks or longer, it may induce the pain in the chest, the coughing up blood or sputum. The other symptoms of the TB include the weakness, the loss of the appetite, weight loss, fever, and sweating. So as we told earlier, that the symptoms of TB depends on the site of the body where the bacteria is affecting. So this bacteria can affect the other body parts also, and this is the bacteria it caused by the one person to another person. Okay, it can be spread through the air from person to person. When a person with the TB disease coughs or speaks or sings, people nearby the patient breathe in these bacteria and may become infected. So there are two types of the conditions if one person is infected with the TB bacteria. One is the latent TB infection, and second is the TB disease. So the bacteria can live in the body without making you sick, and this is known as the latent TB infection. So in most of the people who breathe the bacteria in, the TB bacteria become infected, the body is able to fight the bacteria and to stop them from growing. So the people with the latent TB infection, they do not feel sick, they do not have any sign and symptoms, and they cannot spread the TB bacteria to the others. While if the bacteria become active and in the body and they multiply, the person will go from having latent TB infection to being sick with the TB disease. So for this reason, the people with the latent TB infection, they should also take the treatment to prevent them from developing the TB disease. People with the TB disease usually have the symptoms and may spread TB bacteria to others. Okay, so the testing for the TB is available to everywhere, and the two kinds of tests are very popular for the TB. One is the TST, that is TB skin test, and second is the TB blood test. So a positive TB skin test or TB blood test only tells that a person has been infected with TB bacteria, it does not tell whether the person has the latent TB infection or has the progressed to TB disease. So other tests such as the X-ray of the chest and a sample of the sputum that are needed to see whether the person has TB disease or not. So for the proper diagnosis, many of these strategies are there. First of all is the medical history. When a patient comes to the doctor, it should have his medical history, that is there any TB patient in his family or not. If it comes in the context with the TB patient from any other source, then the physical examination will be performed by the physician. A physical exam can provide the valuable information about the patient's overall condition and other factors that may affect how TB is treated, and such as the HIV infection or other illness. If it is affected by the other diseases, it will be treated very tricky by the doctor. Okay, so next is the test for TB infection. So that is the TST, the Montauk's tuberculin skin test, or the TB blood test can be used to test the Mycobacterium tuberculosis infection. So additional tests are also required to confirm the TB disease. The chest radiography, or we can say the chest X-ray, gives a valuable information. So a posterior anterior chest radiograph is used to detect the chest abnormalities. The lesions may appear anywhere in the lungs and may differ in size, shape, density, and cavitation. So these abnormalities may suggest the TB, but cannot be used to definitively diagnose the TB. So however, the chest X-ray or radiograph may be used to rule out the possibility of pulmonary TB in a person who has had a positive reaction to the TST or TB blood test and no symptoms of the disease. Okay, so they can also be tested microbiologically. Okay, because it is caused by the Mycobacterium tuberculosis, so the presence of the Mycobacterium tuberculosis may be assessed. Okay, the presence of the acid-fast bacilli on the sputum smear or other specimen often indicates the TB disease. So acid-fast microscopy is easy and quick, and it does not confirm. It have the it is a diagnosis of TB because some acid-fast bacilli are not the Mycobacterium tuberculosis. So therefore, a culture is done on all initial samples to confirm the diagnosis. So drug resistance is a problem with the TB disease because for all the patients, the initial Mycobacterium tuberculosis isolate should be tested for the drug resistance. So it is crucial to identify drug resistance as early as possible to ensure the effective treatment, because in many cases drug resistant cases are also there and that are not very easy to cure, or if we have not the information that this is drug resistant or not, so we will give the patient to the normal antibiotics. But the treatment strategy is different for the drug resistant cases and the non-drug resistant cases. So the treatment of the tuberculosis, it include the antibiotics. So TB disease can be treated by taking several drugs for 6 to 9 months. And there are 10 drugs currently approved by the US Food and Drug Administration for treating the TB. So of the approved drugs, the first line anti-TB agents that form the core of the treatment regimens are the isoniazid, that is abbreviated as the INH, then rifampin, RIF, then ethambutol, that is EMB, and the pyrazinamide, that is PZA. So if the case is drug resistant, so drug resistance TB is caused by the TB bacteria that are resistant to at least one of the first line anti-TB drugs. So multi-drug resistance TB, MDR TB, is resistant to more than one TB anti-TB drugs, and at least isoniazid and the rifampin. So extensive drug resistant TB is also there, that is XDR TB, and it is a rare type of the MDR TB that is resistant to isoniazid and rifampin plus any of the fluoroquinolone and at least one of the three injectable second line drugs like the amikacin, kanamycin, and capreomycin. Okay, so the prevention is better than cure. So we have to stop the transmission of the TB from one adult or one patient to another patient. So for that we have the BCG vaccine. The TB education should be there, that how to prevent the infection of the TB if there is any person in the family, how to change the habits that helps in the prevention of the TB disease. Okay, then the treatment should be complete. If any of the person is infecting with the disease, it should complete the treatment. Okay, the treatment should be taken completely, and it should not be leave in between. So it will worse the condition if it is lived in between. So all of them, the prevention is better than cure. So we have to take care about the nearby conditions. If any person is there, any patient is there, how to take care if any family member is infected with the TB disease. So it should be kept in the isolation, or we have to take care. The things should not be used that is used by the patient. Okay, so sharing should not be there for the clothings, for the bathrooms, and for the living room. Okay, so that will prevent the infection or prevent the communication of the tuberculosis disease. So this was all about the tuberculosis. So hope you are satisfied with this detailed session. If you have any doubt, any query, you can write in the comment box. And this session is powered by Digital Version 2, Jayoti Vidyapeeth Women's University, Jaipur. Thank you.